Welcome to the Proactive Women Podcast. I am your co-host, Fran Marie. Our CEO and managing partner of JP Financial Group is here. It's Joyce Palmer. Hi.
Hi, Francine.
We got some big news.
We do. Welcome back, ladies and gentlemen, too. I hope you enjoyed our summer series. We had so much fun. We did incredible workshops, powerful conversations, and we wrapped it up with a big bang, right? And guess what? We're not slowing down. The fall series is coming too, by popular demand. So I want you to check your email boxes, check your Facebook, check and make sure you go to our website, jpfinancialgroupllc.com, to see the fall schedule coming up. This is going to be some added great classes, and you do not want to miss it.
We want to thank everybody who joined us, women and men, because, men are our allies, too. It was jam-packed this summer, and It was all about learning, getting your questions answered, and it was about community as well. So we can't wait for the fall series.
That's right. And because what we know is retirement planning does not stop when the seasons change, right? So we are not going to stop either. We got to keep going.
Exactly. Because here's the thing, retirement, like you said, it doesn't stop. But a quick reminder, before we dive in, we need you to subscribe, like, and share this, because you can't be the only smart one in your group, okay? Visit jpfinancialgroupllc.com, call 704-543-6269, and you can schedule your 20-minute strategy call, Ask Me Anything, with Joyce Palmer. You could do that. But definitely, retirement seems to be far off, that, over the horizon, but for many of us, it's here, or we should start planning.
We should start planning. That's right. And you can ask me anything, just not anything about cooking or domestic stuff. But anything about money is usually a good question. What I find, though, honestly, is that sometimes just talking through the scenario with someone and listening to it out loud, you uncover the answers. In many cases, we already know the answers deep down inside, like maybe I shouldn't shop every week, or maybe I need to exercise tough love with the kids. So a lot of times we know the answer, but just being able to talk through it. But remember here, there's never any judgment, just love, strategies, and accountability.
Exactly.
So I do want to pivot to our topic, right? We're tackling a big one, literally a big one. The One Big Beautiful Bill right here in North Carolina. Because when it comes to health care, ladies and guys, it affects everyone. It's not just one population. It's children, it's family, it's our community. And we are all going to be impacted by this One Big Beautiful Bill as it pertains to health care.
Wow. So as you unpack this, we just want to remind folks that you did a fabulous webinar with Charlotte Post, the Charlotte Post webinar.
Yeah.
We're going to do more, I hear.
Yes. We did a fantastic webinar talking about some of the changes, and we're going to rerun that webinar. We're going to do some more webinars where we kind of look into the numbers and the facts about the Big Beautiful Bill. So let's kind of start with some of the reality, right?
Okay.
Back in 2023, when North Carolina expanded Medicaid, it picked up coverage for over 650,000 individuals were able to get coverage that were not able to get coverage before as a result of the expansion. So that was a good thing. Unfortunately, with this Big Beautiful Bill, that's going to roll back many of those people that were able to get Medicaid at that time. And that's going to have an effect on care for doctors, for prescriptions, emergency room. So one of the big things that we're concerned about is that expansion that we fought so hard to get with Medicaid is going to be reversed. And that's going to project over 520,000 North Carolinians will lose coverage.
Wow. With this new bill? Okay, so if 520,000 North Carolinians lose their coverage, projected to lose their coverage, that's 500,000 people.
Right.
So it's estimated that could be estimated 579 preventable deaths.
Right. And these are real people, real families. So how does it happen? One of the big things with the big, beautiful bill is the red tape. It's going to be a lot harder now to get coverage. It's going to be a lot harder to qualify. It's going to be more red tape. So instead of the eligibility checks that they currently do once a year, they're going to expand that and do that twice a year. So now it's going to be a bigger push to check and make sure that everybody is eligible that's on it. So if you miss a form or you fill out something incorrect, that could mean you lose your coverage completely. Some of the other things starting in 2027, because these are phasing in these changes. In 2027, adults 19 to 64 will have to clock in 80 hours of work, school, or volunteer in order to keep their benefits. So if you have a struggling single mom who's working maybe part-time jobs but not getting 80 hours, boom, she loses her coverage.
Automatically. Wow. Okay, ladies and gentlemen, let's pause right here. That's why we need resources instead of headlines, because they can scare us sometimes. But if you stay with us, a trusted source, JP Financial Group, follow us on Facebook. Go to the website, jpfinancialgroupllc.com. Call 704-543-6269 and ask me anything. Question, it's 20 minutes with Joyce. You can ask her anything. You don't want to lose, because sometimes we're out here and we're just wandering around and we need you.
Right.
You've been doing this for so long.
Yep, we have. And the 20 minutes, like I said in the beginning, a lot of times we uncover the answer as we're talking through it together. And this big, beautiful bill is one that I'll be honest to say it's going to take some time to untangle it and get an understanding. Matter of fact, one of the maybe encouraging things is that a lot of these proposals of this big, beautiful bill are still in court, right? Courts are, pushing back, and they're still in court. So hopefully some of these things may get overturned. But that's really keeping your fingers crossed, right? But that's why it is important for us to rally around information. Reach out, get the phone call, get your questions answered. If you hear something and you're not quite sure, call. I would love to either validate it or unvalidate it, if that's a word, right? Because we're all in this together as we learn through it. So some of the other key things about the bill is that the providers, Medicare providers like the Aetna, the Humanas, the United Healthcare providers are going to take a pay cut as well, or a slash in what they get provided. So a portion of the reason that Medicare Advantage plans can do what they do is because the government gives them funding per person in order for them to be able to offer these Medicare Advantage plans. So they're looking to cut that 3% across the board initially, and there could be more cuts. That's going to hit hospitals. It's going to hit residential services. It's going to be a cut in the rural areas the most. So you're going to find hospitals in rural areas hit really hard with some of these cuts. And what we remember is that 26% of Medicaid patients in North Carolina live in these rural areas, right? So we're here in Charlotte. We're not a rural area, but some of the outskirts, I know where my grandparents live, Warren County, population 2,000, is set to get hit really bad by these cuts because it is a rural area.
Wow. And if you're on the Affordable Care Act website, you're going to clutch your pearls because the premiums are projected to jump get this, from 7% to 36% next year when tax credits roll back.
Right.
Ooh, ouch. Families. So basically, families are going to pay more for less.
Yep. And that's the Affordable Care Act. So this bill spans through all of healthcare. That's why I say it's not just Medicaid. Medicaid is getting hit the worst, but the Affordable Care Act, the health insurance marketplace, Obamacare, some people call it, will get hit really badly. So what we're seeing there is it's positioned to have about 32 billion people lose funding that were getting it through the marketplace. It's going to increase the requirements for submitting information through the marketplace. It's going to eventually cut the time frame that you can enroll in healthcare during the open enrollment season. So all of these are geared toward reducing the amount of people that actually end up getting coverage on the marketplace.
When it comes to planning, I mean, let's giggle here and laugh a little because we've got a trusted source with us.
Yep.
Joyce Palmer, get that 20-minute strategy call with her, right? Now, we're going to be talking about money there. Don't ask her about recipes or anything. You know how we go off? Yeah, don't do that.
Don't do
She's
that.
really good with the money.
Yeah.
So that's
Yeah.
7.
Don't ask me how to help you, stop your husband from leaving his socks in the living room. That won't work. But if you do call and ask me a money question, and like I said, today we are talking about the One Big Beautiful Bill. In all seriousness, whether you are under 65 and you're getting your health insurance through the marketplace has its own changes. So you want to be very, very proactive and give us a call there if you're getting insurance through the marketplace. We're going to be set up to do some in-house reviews. We're going to encourage individuals and help them get their documents together because that's going to be a big way that you can lose coverage. We're also concerned with those individuals that are considered higher income earners. So with the marketplace, they use a tax credit or subsidy based on your income. And if your income falls over a certain amount, then you're not eligible for any type of subsidy or tax credit. So that benchmark has been raised again. So now, in the past, we were able to get coverage or get a tax credit for someone who made as much as 70 or 80 or even 100,000 in income. They could still get some type of tax credit. Well, that's going to roll back now. So in many, many cases, you're going to have an income earner who has 50, 60,000 no longer able to get a tax credit. So if you fall in any of these categories, call us, right? 704-543-6269. Medicare, for those individuals 65 and older, yes, you're going to be impacted as well. Not as many impacts there as it is with the Affordable Care Act or Medicaid, but know that your Medicare could be changing as well. And so open enrollment starts October the 7th. So schedule your time now. The calendar gets booked, and you do not want to wait till the end of the open enrollment season to start finding out about your changes. We're going to, it's just so much. I can't even cover it all right now, but we're going to be covering this information in our webinars, in our fall series. So I would just encourage everyone, don't wait. Call now, find out when you can get registered for the class, or get on the calendar. Let's get some of your questions answered.
Because October is around the corner.
It is.
And so, as the podcast says, proactive.
Yep.
Proactive Women podcast. We love men too. They are our allies. And the great news is we can stay proactive. That's the great news, in that we can get educated, because together we can get through this. We can get through this. And I know your clients are so grateful. And that's another piece of the emotion.
Yep.
You don't want to be so fearful. You want to be grateful that we've got Joyce Palmer.
Yep.
Yes, we do.
Yep. And I am grateful for you. I'm grateful for our listeners. I'm grateful for Francine.
Oh, we're so great. And that puts the heart in a different place, does it not?
That's right. That's right.
Yes,
That's right.
yes.
That's why we all have to really stay awake during this open enrollment season, health insurance, because we're entering uncharted territory. We don't know exactly how big the impact will be, but we know it will be big. So the more that we can put out, the more information that we get, the more we're going to share. But you have to do your part. You have to be proactive and seek information and stay alert to what's going on and not procrastinate.
Right. Put the glasses on and read the fine print.
Yes, put your glasses on.
Read the fine print. And we love that about Joyce and JP Financial Group and the whole team, is that they are always reading the fine print.
Yeah.
Right?
That's
and
it.
relaying the information. Because, when you said gather documents,
I know. And if you haven't done your taxes, if you're on the marketplace, again, you have to do your taxes. You have to show that now, whereas before there was, a grace period for you to get your documents in. This enrollment, there will be no grace period. If you don't have those documents at the time of enrollment, you're not going to be able to get the subsidy or the tax credit. So, yeah.
Ooh, okay, so that's your cue. JP Financial Group, LLC.com. Call 704-543-6269. Get your 20-minute strategy call with Joyce. Ask her anything. And like we said, it's not going to be about recipes. It's going to be about the money.
That's right. And remember,
Pink is the new color of money.